our kids tell us everything we need to know. Your spouse tells you everything you need to know.
How difficult must this be for you to hear that your child is disgusted by the sound of you breathing? This is me going by my gut and my professional
I'm good at
experience.
chair, so let's do this.
Yeah.
Welcome back to another episode of the Unspoken Words Podcast, a Selective Mutism podcast by the Smart Center, produced and published by New Edition Productions. This episode features a discussion between Dr. E and clinical psychologist Dr. Ali Mattu. Dr. Ali Mattu, or Dr. Ali as he's known online, spent 10 years at New York City's best hospitals, treating hundreds of patients with anxiety disorders. Frustrated by how many people mental health care left behind, Dr. Ali quit his position at Columbia University to focus on creating media for those who can't access quality mental health information. Now, his YouTube channel has grown to over 340,000 subscribers. He also created Braver with Anxiety, a 7-lesson online course to more deeply explore how anxiety works and what to do about it. Dr. Ali also suffered from selective mutism when he was younger. Dr. Ali lives in the San Francisco Bay Area with his wife, daughter, and son. In this episode, Dr. E and Dr. Ali discuss misophonia's connection to selective mutism, strategies and tools for parents to support their children with misophonia, misophonia's connection to general anxiety, and more. Before we get started, if you have any questions on anything you hear in today's episode, please head to selectivemutismcenter.org/ask Dr. E, that's ASKDRE, and enter your question. The team reads all of your submissions and does their best to answer them on podcast episodes, blog posts, and on social media. And speaking of social media, for the best of this episode and every episode of Unspoken Words, head over to Instagram and YouTube. We are at unspokenwords_podcast on Instagram and Unspoken Words Podcast by Dr. E on YouTube. All right, without further ado, please enjoy the latest episode of the Unspoken Words Podcast.
Hi, everyone. It's Dr. E. Before we get started with today's episode, I'm so excited to announce that our popular Selective Mutism in the School virtual conference is now available as a self-paced online course. The conference dives into how to assess the mute child, testing for common comorbidities, and proven strategies and interventions to support students with SM within the school. And of course, we dive into accommodations and interventions such as 504s and IEPs. The course offers 5.5 continuing education credits from most professionals. So parents, share this opportunity with your child's school. To sign up, just head to our website or check the description in this podcast episode. Together, we can create a world where every child has a voice. Now, enjoy the episode. Hello, listeners. Welcome to another episode of Unspoken Words. And it wouldn't be me if I didn't say I'm super excited about today. We are with Dr. Ali, and he has a very popular YouTube and social channels called Braver with Anxiety, and his YouTube is Dr. Ali. You can find him right there. And I am really excited today. And one of the topics we're going to talk about mainly is misophonia. And I'm thinking our listeners are like, what is misophonia?
Dr. E, I don't know. Sometimes we name things in a way that makes it so confusing for people to understand what they are. And I think misophonia is one of those.
I think SM is too, because selective mutism is anything
Yes.
about not speaking. So the term stinks. So misophonia does not, in my mind, really give it a great representation. But I guess we could start out by saying, what the heck is misophonia?
The term means hatred of sound. I don't really think, like selective mutism, I don't think that really does it justice. What misophonia feels like and what the experience is, there are certain everyday sounds that, for people who experience this problem, provide so much emotional activation. And it's usually anger, it's disgust. You go from 0 to 60 almost immediately when you hear the sound. And it makes it incredibly difficult for you to stay in that space and for you to focus on anything but that sound. And the kind of sounds, I'm not talking about like a jackhammer and there's construction going outside. Everyone's going to be frustrated by that. I'm not talking about a really loud neighbor that is very distracting. I'm talking about the sounds of chewing, I'm talking about the sounds of breathing. I'm talking about small tapping sounds. These are things that most people, it wouldn't even register on their radar. But for someone like misophonia, if for most people the sound of somebody chewing is like a 0 or a 1 out of 100, for people with misophonia, it's like 100. It's all you really hear in that moment. And it's incredibly frustrating and makes everyday moments very, very difficult, Dr. E. It's really, really gets in the
You
way.
know, a really big premise to understanding what selective mutism is figuring out why somebody either developed it or why it's continuing on. And so many people focus on getting kids to talk. And when I hear you and what I know about misophonia, because one of the reasons I was excited to talk with you is I've quite a few families with children with misophonia, and that's almost in the sideline. They may not even know it's that. Sometimes they see it as defiance. The child just doesn't want to talk or won't eat at the dinner table with their parents or won't go to the cafeteria, not just because it's loud, but these sounds. And families often don't understand what it is. But the interesting part is that treat to speak phenomenon with SM and be really brave to talk makes no sense when you think of it from this perspective, because these kids, these individuals that have misophonia, they can't help it. And so what happens to these individuals in your experience in those settings?
Yeah, this is what's really interesting because if you asked me this question 15 years ago, I would have kind of gone, I don't know, Dr. E. I don't know what's going on in their brain. And this is one of the things that gives me a lot of hope for the future is one of the great things about the internet that's happened is communities have formed and we have more of an awareness of the diversity of human experience now because these communities have gotten together because it used to be not too long ago that people who had different sensory experiences of the world, we kind of dismissed them as a field. And now we know there's things like synesthesia where you can see and hear things that other people don't. And now we know there's so many things in life actually exist on a spectrum and I think misophonia is one of those. So to answer your question here, what's going on inside their brain? Well, let me get one caveat out of the way, which is we don't yet really have an agreed upon definition of what makes for misophonia. So in the United States, we have this Diagnostic and Statistical Manual, blah, 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 the DSM. It's a mouthful to say. What's important about having a clear-cut diagnosis is everyone agrees what makes for misophonia and what makes not for misophonia. And when everyone agrees, then it becomes a lot easier to study that because we can tell, okay, these people over here, they have misophonia, these don't. Let's try to understand how they're different, how they're similar, all that kind of stuff. We don't yet quite have that with misophonia, which is a little bit of a problem. But in general, what we agree upon is people who have misophonia, they're experiencing this strong emotional reaction to everyday sounds, and it makes everyday life very difficult for them. So if we go along with that definition, there's actually been more studies coming out that have looked at what is actually happening neurologically, what is actually happening inside the brain. And early on, people thought this might be more of a auditory problem, like tinnitus, where you're experiencing sounds. It's sort of like having all the volume is turned up on all sounds, and it's very disorienting. It's very frustrating. It's hard for you to just listen to the world. And some of the early research here has shown that this is different. This misophonia is a different problem because it's not related to every sound. And what we now know, and this research is limited, it's evolving, but in general, there's enough of this research I now think to confidently say that what is happening with misophonia in the brains of people who have misophonia is they hear certain sounds and the part of the brain that's involved in emotions and the part of the brain that's involved in memories is activated in a way that it's not activated for anyone else. We're not 100% sure why, But we can confidently say that the biology of people who are experiencing misophonia is different. And the way that it's different is emotions are getting activated that probably don't need to be activated, and memories are getting activated that probably don't need to get activated. I feel like it's a little bit similar to what happens with obsessive compulsive disorder. And I'm not saying these are similar problems, but what happens with OCD is in an everyday moment, your brain experiences distress, anxiety, and your brain tries to come up with some type of story to explain this distress. And so you might be walking through your life and then you feel uncertainty, and then your brain is saying, well, maybe you're feeling uncertain because you didn't actually turn that light off. And maybe you should go check that because something bad could happen if you don't do that. Our brains sort of find a way to make sense of the world that we're in and the circumstances that we experience. And with misophonia, for some reason, we don't know why, but emotions are getting activated that don't need to be activated, and your entire focus becomes sabotaged by the
So
sound.
basically,
It's not the
yeah,
person's fault. It just sort of
right. So when I
happens.
see parents getting frustrated, my hope is they're listening to this going, wait, I need to step back and figure it out. And SM being an anxiety disorder, talk to me about the anxiety connection, because I can imagine this causes avoidance
Yeah.
and causes heightened anxiety. And so much of our life, look, SM is a social communication anxiety. Having misophonia
Yeah.
affects your ability to socialize. Everything we do is in places with sounds, and many of which you
Yeah.
shared: chewing, crunching sounds, repetitive noise, clicking of pens, tapping
Yes.
of a foot, breathing, sniffing. These are social stuff.
Yeah, they're social stuff, they're everyday things. And yeah, so there's a strong anxiety connection here. A patient of mine very well described it to me, where he said, imagine that you are in the reading room of a grand library. And this is it's almost like this person is a writer, so you can see where they're going here for their love of written word. But they said, imagine you're in this grand library, a temple to literature, and there's just one rule here, and that is that when you're in this reading room, you're not supposed to make any sounds. You're supposed to be quiet, and you're just supposed to read. Now imagine you're there and you're reading something you love and enjoy, and there's somebody right across from you that is making a very loud sound. They're tapping, and they're tapping, and it's distracting and disorienting. And imagine the frustration you would experience at hearing this, and also imagine the frustration when everyone else is just ignoring this. And you want to say, look, this person is breaking the rules. They're not staying quiet. Aren't you all distracted, disgusted by what is happening here? Isn't someone going to do something about this? So you have the anger, frustration of the sound, and then you have the anger and frustration that nobody else realizes this, nobody sees it, nobody's doing anything about it, which makes you feel so much more enraged, frustrated, invalidated, alone, isolated. So that's kind of what this experience is like. And the way it connects to anxiety is any situation where you know reliably these sounds might be occurring, you, you are on guard.
So no, that's a great example. And I, of course, with my, attention towards SM and hyper focus on that, I think to myself, conversations, the child is mute, the teen is mute in a social situation. Well, it's similar, like they can't have the conversation. If you have misophonia, you're so busy trying to just process that noise. Like you said, you've got all of those thoughts going through your head. How can you have a conversation? Hi, how are you? Good, how are you? What are you doing this weekend? You can't do that. You can't engage in a debate in class. You can't answer the teacher because the kid next to you might be tapping or breathing, which most do. And so the whole premise of why is social communication so difficult in someone with SM, that why of SM, because I'm always about what is the factors into the development and maintenance of it, having misophonia alone is a reason not to be able to communicate effectively if those sounds are bothering you in all of these social situations, in school, with peers, with teachers, at a restaurant, at a store, at a birthday party, at soccer, at gymnastics, even in a small play date situation at home. If these sounds, how can you build social communication skills and how can you build peer relationships well if the everyday sounds or specific sounds that bother that child are involved with those kids that they're trying to be friends with? How do you deal with that?
Yeah, absolutely. And it's very, very difficult, especially as a therapist or as a parent or as a teacher, and to try to understand what's going on here, because there are so many reasons why a child might not be communicating. And sometimes it's anxiety, sometimes it's disgust, sometimes it's not knowing what to say. There's so many reasons why a child might look frozen. And misophonia can definitely be one of those things. I can give a personal experience. This is, it's funny how life kind of works out
Yeah.
sometimes. I spent a long time treating this problem, and it was with some detachment from it, and which is different than like I was definitely a selectively mute kid. I've always had an interest in anxiety. I
Wait,
had
you had
social anxiety.
selective
That
mutism?
was Oh yeah.
Wait, how come I didn't
Yeah,
know
yeah,
that?
yeah, yeah. This is why I got your email. I was like, absolutely, yes,
Oh
I'm gonna say yes
my
to
gosh.
this show.
You know what?
Absolutely.
Maybe
Yeah.
you told that to Brandon, but I didn't know that. I'm like, and listen to how outspoken you are, right?
Well, it's a journey, right? It's so I was a kid who, if I was outside my home, I just did not speak. And this persisted from kindergarten to second grade, and then it started to evolve into more social anxiety. But what happened for me is, I learned really early on that if I didn't speak, someone else would speak up for me, and and that was great until it wasn't. And so social anxiety and anxiety and selective mutism, these are things that have always been very
I
near and
knew
dear to my
social
heart.
anxiety was, and that was one of the things that attracted us
Yeah.
to you. But the SM piece of that, I mean, I'm really excited to talk with you because I feel like we could talk forever because I feel like when
We
I
could do
talk to
that.
professionals about SM in general, so few really see it from the perspective of SM is a social communication anxiety. And you have to see it from that perspective rather than treat to speak. Because that philosophy, if the child or a teen or whomever isn't in that place, all you're doing is reinforcing anxiety and avoidance. And it's just like what you're describing, like that sense of shame. And so it's how do you teach parents and all of that. That's why for us, so much of what we do is parent education. I mean, our camps are all day. The kids go to camp at Communicamp and the parents go to camp at Communicamp.
The thing that really frustrated me, Dr. E, is that I didn't even understand that I had selective mutism until I was in graduate school treating it. We had a behavior therapy center in Washington, D.C., where I was going to grad school. I was working with a group of mostly selectively mute kids, and my supervisor was explaining to me what selective mutism was when we first started getting ready for this group. And, I sort of connected the dots. I'm like, oh my gosh, this is what I had. And back in the 80s, that was not it was far less known than it is now. So we could spend hours talking about selective mutism. The thing that I didn't have personal experience with was misophonia until I had personal experience with misophonia around 2018, 2019. I started developing misophonia related to the sound of my wife flossing her teeth.
Interesting.
Yeah. Yeah, yeah, yeah. So you might be saying you might have a lot of
I
questions
do,
here.
but I'll leave that.
And
Yeah,
yeah.
off the podcast.
Well, the first question you might have is, so Ollie, how impairing is this? Because your wife is in the bathroom, just don't be there when she's flossing her teeth. For some reason, what happens with misophonia is it often is associated with specific
I was
people.
just going to say that.
Uh
It's interesting.
yeah.
Like, yeah, I noticed that with my patients of mine, and it's interesting you say that. So please elaborate.
Yeah, well, with my patients, it's often a sound of a parent doing something, the sound of a spouse, the sound of a coworker. Sometimes it's
So why
random
do you
people
think
too.
that is? Let's dig this. Let's take this apart. Why is that?
This is me going by my gut and my
All right, and
professional
I'm good at chairs, so
experience,
let's do
and
this.
yeah, yeah, yeah. Because we don't have a ton of scientific answers for that stuff because it's not as well studied. I think one is you're just getting more frequent. You're more frequently hearing these sounds from someone you're close to and you have frequent contact with. Number two, your relationship with this person is also more emotional. They're not a neutral person. They mean something to you. Number three, I think it's easier for us to become emotional with our families and our close friends than it is with a stranger. So I think you're hearing the sounds more often. You have more of an emotional relationship, so you can have causal explanations. Like you can think someone is doing this intentionally in a way that you might not with a random stranger, and all of this can make you very emotional. I've always been a kid and a grown up now who is sensitive to sounds in largely a good way. Like I love music. Music has a way of focusing me when I need to do work. It incredibly quickly changes the way I feel. I hear sounds in the environment that my wife and daughter don't. My son I think has inherited this, and he hears the exact same sounds I do, which makes me a little worried that he might develop a little misophonia. The two of us will be sitting there and he'll be like, Dada, the airplane. And I'm like, yeah, yeah, I hear the airplane. And then my wife and kids are like, what? Or my wife and daughter are like, what are you talking about? I hear stuff that a lot of people don't. So I've always been sensitive to sounds, and at some point I developed this misophonia, and we can talk about what I did, but yeah, it became a personal problem for me too.
Well, it's interesting because when you were talking about the people, I was like, I'm thinking on my patients. And it seems like I'm thinking from like what I see in my clinical practice is, first of all, a lot of our patients, a lot of our individuals with SM have sensory sensitivities. It's a huge Y of SM.
Yes.
So louder, larger, lots of people environments will shut them down, will cause them to go in. How can they communicate in those settings? So it's about setting up school accommodations and training parents on, going to stores during off time and whatever. There's a million things you can do, right? But what I think happens because of this hypersensitivity and all the things you said, what I see is like, there's a lot of parents that aren't meeting their children necessarily where they're at. And their children sense this like sense of expectation. So they're very attuned to their parent, especially the one with the misophonia.
Mm.
Like an example is a little girl I'm working with and her dad. Love him, amazing. He wants to learn, very invested in the treatment and implementing, but he was very critical of her. And so she was very
Mm.
used to, whenever he was around, wanting to please. So she became so hyper aware of him and his presence and what he was thinking to please him that any sound he made pissed her the heck off. So yeah, I mean, I guess I shouldn't say
Yeah.
that on live podcasts, but the bottom line is it really did. And to the point where she wouldn't eat dinner at the table when dad was there. Well, this is how I saw them when they presented to me. Wouldn't go places with dad alone, wouldn't sit next to him in a movie when the family went out. And it was very directed towards dad. And there's nothing else going on. There was no abuse, God forbid. It was truly this
Mhm.
like issue that was occurring. Couldn't stand when the dad chewed. The chewing was the biggest issue for her, and his breathing.
Mhm.
But I kept thinking to myself and then applied it to about, quite a few others. It always seemed to be the hyper aware of wanting to please and the sensitivity with that parent. So because they're so aware of that parent, it's almost like they heard them breathe. So I'm just shooting
Mhm.
from the hip here.
Yeah. There's many pathways. There's many pathways into this problem. And I think my own, I wonder if we could go back in time and ask 6-year-old Ali some of these questions. I didn't have a therapist back then. I didn't, yeah, I certainly did not have a relationship. Yeah, I have a great relationship with my parents, and I'm fortunate they're still alive. I still have them in my life. But I did not have a relationship where I communicated my distress and when I was anxious and when I was uncomfortable. And so who knows if there is some history of misophonia that goes back way back into those early years. But I think for kids there are so many pathways into this problem. I think for adults, some adults have experienced this their whole lives, and then some spontaneously develop it, more like I did. But even if you dig deeper there, I was always a kid that was sensitive to sound, so maybe it was only a matter of time. Who knows? I think there's definitely something there, Dr. E. And yeah, I think one thing to remember about kids is, like adults, kids are doing the best they can, and they have a harder time communicating what's happening to them than adults
Yeah,
do.
they don't understand.
They don't understand.
And you have to
Yeah.
meet them where they're at. I mean, one of the biggest messages I give to parents is you can't be one step ahead and you can't be one step behind. You've got to really be where they're at for
Yes.
them to build the trust and understanding with you and to be able to open up so you can, because that concept of look, listen, and learn, our kids tell us everything we need to know. Your spouse tells you
Yeah.
everything you need to know. It's all there, whether it's nonverbal, whether it's verbal. You just got to like be there and observe and understand because it's all there. So it's,
Yeah.
that sound bothers me. It's not, well, it shouldn't bother you. You need to make friends. And I hate those
Yes.
terms. You should, you shouldn't, you need to. It makes my blood curdle because as soon as you start like that with kids, you lose them in the process. Trust is broken, safety's gone, lack of control, shame.
Yeah. Yeah. There's a couple of things here that I like to tell parents. And one is, so much of your job as a parent is to kiss the boo-boos. And it's very easy to do that when you see the injury, when you see the cut, you see the bruise, when the person is bleeding. It's very easy to stop the bleeding, put on a band-aid, give them a hug, kiss the boo-boo, right? It's harder to do that when you don't see the pain, when the pain is emotional, when it's psychological, when it's disgust, when it's anger. It's very hard to kiss the boo-boo, but our job is the same. When we hug and we say, I'm sorry it hurts, I'm sorry you got hurt, we are validating that you are hurt and I am here. Know that I am here to help you, and I'm going to soothe you, I'm going to love you. We need to do the same thing with selective mutism. We need to do the same thing with misophonia.
Hey listeners, we'll get back to the episode in a second. I want to tell you about Communicamp, our popular 3+ day intensive group treatment and all-day parent education and support program designed to help parents, children, and teens overcome selective mutism, social anxiety, and extreme shyness. Over 3+ action-packed days, your child or teen will engage in immersive activities guided by expert clinicians that build confidence and communication skills in a supportive, fun, and collaborative environment. Spaces are limited and spots book up fast. To learn more, please find Communicamp in this episode's description or head to communicamp.org and complete our interest form, and our team will be in touch. Let's help your child or teen find their voice at Communicamp. Let's get back to the episode.
Yeah, it's in line. While you're talking, I was bringing up your pre-recording questionnaire, and one of the things that stood out with what
Yeah.
you wrote was how many people in the mental health care are left behind. And this kind of makes
Yes.
me feel that way too. And it goes back to that invisibleness and not being able to see it and misunderstanding things. So it sounds like a lot of what you're saying, you're just so like me, so passionate. Like you're probably like me, we're very hypersensitive. We see things that most people don't see, but we have to teach our
Yes.
patients, we have to teach our parents that we work with to see the things that we see so clearly. And I think that's the gifts that
Yeah.
hopefully we give to our families. At least that's what I hope in my heart is that, because that was the whole reason, I mean, opening up is why I wanted to do this podcast. I've had 30 years of
Mm.
experience and I'm like, how do I get this out? Like all these things I see, all these things I know to be able to get out to the public. And that's why it's so exciting to talk with someone like yourself because you're so engaging and you have such passion. And I love meeting other professionals that feel like I do.
I would 100% agree with everything you've said. It's because we're so. One of the things that drives me is a frustration with how few people I can serve in my day to day. And I did not get into this field to help a small amount of people. I got into this field to help a lot of people because I know what this pain is like, and I know how these problems impact families. I think if you could talk to my parents, they would say, I wish we knew how much Ali was struggling with anxiety, with selective mutism, with and if I did pull my wife into this room and she, you ask her like, oh, so this flossing thing, she would say, I had no idea because I hid it for so long. Even as a licensed practicing clinical psychologist who treated misophonia, I spent a lot of time keeping it to myself before I told my wife about it because Dr. E, I was second guessing myself. Is it me? Like, she's just fine. What's wrong with me? As someone who treats this problem, it took me so long to realize, oh my gosh, I'm experiencing misophonia myself. It's developed into this thing. So one of the things that I really believe strongly is we can always find a way to validate the experience that someone else is having. We might not agree with it. We might be frustrated by it. We might want to change it. And whatever the person is experiencing, that is their true, authentic experience that they're having.
So
The emotion they're having is the emotion they're
absolutely,
having.
meeting them where they're at and really trusting. And I always say, give words for their feeling. You seem frustrated right now. You seem angry right now.
Yeah.
Because a lot of
Yeah.
kids in general that we work, and we work with kids, teens, and adults, but a lot of individuals we
Yeah.
work with have a really hard time expressing their feelings. And so giving them those means.
Yes.
And I think I would like to spend some time going over strategies to support those affected by misophonia and SM, because when you
Yeah.
talk to our listeners, they want the meat and potatoes. They're like, give us the strategies,
Yeah.
give us the info. So as much as I love explaining it, and I think we both have done such a, like you especially, such a great job of talking about it, and parents going, whoa, my son has that. Whoa, I have that. This makes sense to me
Yeah.
now. Let's kind of talk about strategies. What can parents do to support their child?
First, be on the lookout for this, that this is a possibility. That I do think this is very hard as a parent, and it is absolutely, I think, Dr. E, one of the most critical skills that we can share to parents is to approach these situations a little bit like a scientist, is to try to understand, okay, my kid is having a hard time here. Let me try to understand what are all the things that could be going along with it. And you said it very eloquently before. Is it the environment? Is it an overwhelming sensory experience? It could be that. Is it not knowing what to say? Is it something specific to the interaction? Let's enter. Hopefully, the goal of this, or hopefully, one thing that comes out of this conversation is now you have one more tool to understand this. That is it a disgust is of a sound? Is it an anger of a sound? Is there one particular sound that is so overwhelming it's blocking everything else out? Because Dr. E, the thing that my patients so often share, the younger kids just will share more that it's gross, icky, it just makes them mad, that like, I just that sound, I can't. They'll have more of an aversive reaction like that to a sound. More teenagers, young adults, they'll share more of an anger or a disgust. They might be able to keep it in, but find it incredibly, just like it's like vomit. It's this disgusting thing that certain people do,
So
and they
how
just want to
so
stay
how do
away
you
from it.
answer the family that says my son won't, or my daughter won't hang with dad, we can't go out to eat with dad, he can't stand how dad chews and how dad breathes. Like dad has to chew
Yeah.
because he has to eat, and dad has to breathe. So what?
So yeah, Dad can't stop
Right. Like, I
breathing.
mean, I understand you can eat in a different room, and that's not going to really
Yeah.
sustain the family in life. Like, that's not good. But the breathing part,
Yeah.
like, unless they're never together, how do you? So, what do you
Yeah.
do? What do you do in that situation?
This
It's
is
a big
where
question,
we
but like,
have
this is hard, and we've had
yeah.
to like do desensitization.
Yeah. This is where I think we need to just pour the validation into the room, it's not only the child or the person
Yep.
struggling with misophonia who needs validation, because this is not their fault. They did not ask for this. It is just the way their brain is wired right now,
Hmm.
right? This is not the kid's fault. At the same time,
Right.
we also need to validate the parent. How difficult must this be for you to
Exactly.
hear that your child is disgusted by the sound of you breathing? That's really you know, that is really, really hard. Kids can sometimes be so honest in a way that is just can make you feel so torn down,
Yeah.
right? So that's very hard to hear. So validating too of the person who's the target of the misophonia, that this is a horrible thing to feel. Like something you never even thought of, something that's not even in your control. Your child finds it so abhorrent that they are refusing to go into these situations if you're there. That feels terrible. And so that's a first place. Well, number one, starting place, let's enter this into your tool chest or tool belt,
Yeah.
whatever
Toolbox.
your collection of tools there. Your toolbox there. Thank you, Doctor. That's what I was looking for. This is a new tool, a new way of understanding things. Number two, we need to validate everyone involved. It's no one's fault. It's no one's fault. This is just part of the diversity of how humans experience the world. And let's make sure we can we can unpack those feelings and make everyone feel heard and understood. Those that's a starting place of the meat and potatoes. That's where and sometimes there's a lot there. Like you can't start to make a
Right.
change until all these feelings are kind of out in
So
the open a little
acknowledging
bit.
it, assessing it, getting it out in the open, dealing with the pink elephant in the room, and
Yeah.
helping parents not personalize it and get frustrated at their child, to me, is the first step too, because children react to their
Yeah.
parents more than, you know what I mean, more than anything, even though, it goes the other way too. I mean, what I've done in these situations is we've worked on ways to desensitize, to chewing, to
Yeah.
breathing, and working in like a hierarchical way, and, coming in, and it takes time, but it works. But because I've seen that connection with high expectation and that hyper awareness to that parent's like sense of approval, we've had to work on that, because until that was actually worked on, the child was just so hyper sensitive to that. To that.
Yeah. Yeah, and this is just like there's many pathways into misophonia, there's also many ways in which we can approach it. So historically, this was understood more as an anxiety problem, and the main approach that was brought was much more exposure based. Let's get people more used to the sounds. That's one tool. What we also know now is it's not so much anxiety in the moment. There is anxiety before, if you know you're about to eat and you know this is a situation that triggers misophonia, you're going to be anxious about it. For me, when I saw my wife get up to go get her floss, it made my heart start racing. I knew what was coming, and I'd sort of brace myself, like, oh my gosh, here it comes. Like, how bad is it going to be today? So all of that was
Yep.
anxiety. But in the moment, misophonia is much more likely to trigger anger and disgust than it is a fear response like anxiety, stress, that kind of stuff. So we have more tools here. So we have a lot of
Yeah.
tools here, right? So one thing is we can do some more desensitization, we can do more exposure, we can record these sounds, help kids and adults get used to the sound in different ways. What's fun now is we have a lot of tools available where if we record that sound, we can change it. We can slowly get people more used to it. There's a lot of tools there. But then there's also how do we mediate the sound in the moment? So that could be wearing headphones. It could be wearing earplugs. It could be being a bit farther away from the source.
Breathing, calming exercises.
It could, yeah, you can do some emotional skills that change the way you feel. A big one that has helped me personally, if I am Dr. E, if I'm really absorbed in what we are watching, my mind tunes out the misophonia.
Or distraction.
Yes. And this is one where it's distraction to the next level, where if my mind can zoom in on a different sound.
100%. So that's what I did with this one family where
Yeah.
they had music in the background. And the child loved
Yes.
music and he loved
Yes.
a specific group. I can't remember what the group was,
Yeah.
but one way we worked with them is we had the music and we would work on disconnecting from dad's breathing to the music. And so that helped. And it sounds exactly with what you did.
Yes, yes. So misophonia is a
Yep.
sensory
Yep.
problem that is triggering
Yep.
emotions. And if we change the senses, we can corrupt this whole
Yeah.
process. So
I
it,
think
it
we
might not
figured it
even
out
happen.
doing this one.
Creating different sounds can be helpful. Sometimes blocking the sound, sometimes creating different sounds. And this is where, one of the ways in which these noise canceling headphones that are much more common, what they're doing is they're taking sounds that are coming in and sort of creating the opposite sound and sort of pushing it out so you don't really
So how
hear it.
is that different from
I,
when, let's say you're flying on an airplane, right? And there's been a lot of flight
yeah,
phobia lately with everything happening. You put them on, you listen
yeah,
to calming music to get out the sound of the engine of the plane. It's no different.
sure. It's no different. It's no different. And our world is becoming so much more noisy, quite literally. We're living in more congested places. There's more so much stuff is happening. There's so much literal noise in the environment that this direction is a good direction of all the noise canceling stuff that's available. I think given the direction that AI is headed, and in 5 years or so, our products for noise canceling are going to be so good that we're going to be able to hyper focus in on certain noises that bother us, and we might be able to kind of wipe away this problem. I hope. I hope we might be able to. In many situations, you could train your noise canceling headphones that, it's really this specific sound that bothers me. Can you just delete that? And I think we might be able to do it. The other big thing I want to mention, Doctor, we mentioned a lot about exposure, desensitization, blocking out, tuning into different sounds. One more thing that's really important here is on the anger front. What I found really helpful is when you think about anger and approaching anger-based problems, there's a lot of things that can help. So sometimes if you're angry and the anger makes sense, you want to actually take action on it. I mean, one of the reasons why anger exists is to break us out of our everyday norm and to do something to address an injustice, to do something to address how you're being blocked in some way, right? So anger is an emotion that's really built for action. But if you're experiencing anger related to your dad's breathing, you don't really feel like you have much you can do. So that anger has to be addressed. So one way that you address it as a parent is to say, if I experienced the world in the way that you do, I would be reacting exactly the same way. And I am so sorry that this thing I am doing is making you so upset. It's not your fault. If I heard sounds this way too, it would make me really upset. And I wouldn't want to go to dinner. I wouldn't want to do this. I wouldn't want to do that. I wouldn't want to be near me. You gotta acknowledge the anger. And as you start doing that, the person might change the way they're experiencing the anger too.
Yeah.
Because now I'm not the crazy one. This is not my fault. It makes sense why I'm experiencing this. You gotta deal with that anger because anger is so wired for action. And if you feel like you can't take action in this moment, it's gonna bubble up and it's gonna explode at some
No,
point.
it's really, really very, very interesting. Before we end, I'd like to talk a little bit about school and accommodations to help these
Yeah.
kids and that premise of
Yeah.
kind of comfort precedes communication. Progress doesn't happen in a group. So we have to do things kind of away from the group. In some ways, things like small groups away from the full class, if things like clicking or in specific sounds, but lunch bunch, a recess bunch, a friendship group, sometimes removing them from that full group, which is where they're kind of overwhelmed or the sounds really get to them. That's been ways that we've worked with them. Of course, taking the specific issue that the specific child has. But what are your thoughts on that? And we've had to wear the
Yeah.
the headphones a little bit in the larger groups and the assemblies, and certain sounds just made them shut down.
Yeah, this is where I think parents need to know two things. One is you have to be the advocate for your child, and many teachers might not even know what misophonia is. I mean, I'm sure, Dr. E, this is something you come
All the
across all the
time.
time. Is a lot of teachers don't know what selective mutism is. They've never heard those
Or they
words.
think it's kids that
They
are
they
choosing and refusing to speak, and therefore they're gonna do
right
everything they can to get this kid to talk, and they'll give them bravery.
push them.
Push to talk, you
Yeah,
gotta talk. If you don't talk, and that whole word "talk" causes their blood to curdle, because many of these
yeah,
kids aren't there yet. Some are, and you're able to
yeah,
talk about it, but a lot of kids just aren't there. So that's where my social communication bridge comes in, because at least they're on the bridge and we're helping them understand where
yeah,
they're at. We're giving them the control. They're understanding their feelings. It's a beautiful thing when it works and everyone's on the same team. But it's the same with misophonia. If the teachers don't understand that and they're like, oh, he's just being difficult, or he's acting out, or he's shutting down and he's putting his head down, like he's disinterested. Does he have a learning issue? Or is the sound of the papers
yeah.
turning that are making him crazy? So, yeah.
Yeah. Yeah, so you have to be an advocate. In my experience, teachers are usually in two and teachers are dealing with a lot. They're really overwhelmed. And so this is another reason why you have to be an advocate, because it's not their responsibility to figure
Yeah.
these things out, but it is a responsibility to accommodate in a appropriate way what the unique need is of their children, of the kids that they teach. So in my experience, teachers are often push, push to talk, or accommodate the
Right.
heck out of it.
Don't ask
And
questions.
that
Don't ask questions.
yes.
I'm not going to ask
Yeah.
questions. Don't worry. I won't ask.
Yeah, and that's not,
No.
like you said, you need a bridge here. So number one, you have to be an advocate for your child, which means you need to know and understand this problem. The second thing is you have to experiment. So what I think is great is there's more an awareness of kids with unique needs, whether it's related to ADHD, whether it's related to autism spectrum. And I think more teachers are a little bit aware of how there is a spectrum of sensory experiences. And some kids need to tune out a little bit. Some kids might need to tune in a little bit more in different ways. So when you are struggling with misophonia in the family, there has to be some type of experimentation. And the example I'll give you, Dr. E, I've had a child that I work with who did better when they were in a lunchtime situation where there were less sounds, where they were eating more separately on their own, and they couldn't eat if they were in the main
Yeah.
lunchroom and there was all that
Yeah.
commotion going on. They needed to be in more silence. I've also had the exact opposite, where a child needed all the sounds to block out the little tiny
Hmm.
sounds. And so, if that same child was in a quiet environment, their brain would hone in on a unique sound and they would get disgusted. They wouldn't be able to eat. So, the accommodation for that child was actually to eat lunch outside in the playground area where they did hear all the commotion, and it made it easier for them to actually eat. So you need a little bit of an experimentation, because you don't know what is going to work, and you need a willingness to try. And so the situations I usually look out for, lunch and eating are big ones, because that's where, just statistically with misophonia, so much of the sounds are related to mouth related movements, mouth related sounds, and a lot of that just happens in eating. And if your kid isn't able to eat because they're disgusted by these sounds, well, now you have a second problem, which is they're going to be hungry, which is going to make them irritable, which is going to make the whole afternoon not go so
Yeah.
well, right? So lunchtime is a big one. The other is tests, any type of performance situation. Those are situations where it's very quiet, emotions are high because there's stress involved. And because it's so quiet and because they're so emotional, it makes it very easy for their minds to focus in on a certain sound, whether it's a tapping, whether it's a sneezing, a runny nose, whether it's someone else doing a kind of a lip smacking situation. So fortunately, a lot of teachers they're aware of learning related accommodations for testing in a different environment or extended time on tests or wearing kind of a noise blocking, oh, what do we call those, not noise blocking headphones, but those oh, they're just they're like the what construction workers wear that just kind of block out sounds.
Not the noise canceling headphones?
I guess we call them noise canceling headphones. They're not powered. There's no on off
Yeah.
switch. It's just a thing you wear that kind of blocks
Yeah.
out a lot of sounds. So there's a lot of different ways to approach this problem. So you got to be a good advocate. You got to be willing to experiment. And the last thing, and I think this is one of the hardest things, is we need to empower the kids in our lives to be their own advocate. Because you can have the best accommodation in the world, you can figure out what works, but if the teacher is busy and the child isn't able to advocate for themselves, the accommodation might not happen. And so as children get older and they're in the age where they can advocate, this is where we get back to anxiety, is let's empower you with the words. Let's practice how to say them. Let's work together so that you and the teacher have a good relationship when you need these accommodations, that you can ask for them. It's this collection of stuff that I think we really need to do to set up our kids for
No, for
success.
sure. Any last minute tidbits you want to give our listeners before we end this?
These things go up and down and change and they evolve. Once my wife and I had a conversation about it, she felt so bad and she had no idea that this was happening. And I felt so bad because through that conversation, I learned she's not she's not just flossing in this way to torture me. It's something for some reason that her family always did together and it relaxed them. And so what we did is we started, when she was going to floss. Number one, she gave me a heads up, so it was never a surprise. During that time, she went all the way to the other side of the room. We tried to turn the volume up on the TV. And so much of what helped me is just feeling like she cared and she was
Yep.
trying. Because then I wasn't angry at her. We were both angry at this
Yeah.
problem. It wasn't my fault. It wasn't her fault. It just is. And we were working together to figure it out. In a week, maybe now this comes up, coming up in a way that makes it hard for me, maybe like once or twice now, when it used to be daily and I was suffering in silence. And I think the same thing is true of many of my patients. Is it evolves, it goes up and down, and it changes. So just because you're struggling with this right now doesn't mean you're going to be struggling in this way forever. It just means it's the way it is right now.
And I think the way you talk about it, like I can picture, the dad and the child like coming together and the dad making like humor often works really well with a lot of kids. So the dad goes
Yeah.
as a breathing and like desensitizing, kind of like making light of it, but seriousness, but kind of detaching from it and being open about it. Like, dad, it's happening again. I'm going to go in the other
Yeah.
room and just kind of dealing with that pink elephant in the room. So rather than build that resentment, that anger on both sides. So I think there's a lot of messages here for our families. And I think a lot of people learned a lot. And we're definitely going to share your wonderful resources because you've got so many, honestly, on there.
Yeah, come together to work on this problem together. I think that's the big
Absolutely.
message here. Don't take it
No,
personally. It's not. Yeah, it's believe me, no one wants to be feeling this
but
way.
it's like all these
Um,
things in mental health. I mean, if you don't acknowledge it exists, how can you overcome something? And so much
yes.
about like helping individuals with SM is helping them understand what it really is and what they feel. And taking that
Yeah.
like putting the like popping that air, like that big balloon and just getting it out there and realizing, look, and I always tell families, focus on what the kids can do, not what they can't do. And you just see their
Yes.
body language change. You see their confidence go up. Not you can't talk, you need to talk, you got to talk, but look at all the great things you can do. Look at all how one, yes, this is a little
Yeah.
hard now, but we're working on it, And look where you
Yeah.
are on the bridge. And that's what I do in therapy. Like, I help the kids realize, look where we're at now. Look where we were then. And look how far you've come. not you need to be here. You got to do this by this date. Like, I'm telling you, Dr. Ali, I hear this all the time from families, and many families, not many, but enough families will call the center and go, well, I don't want anyone to talk to my child about this. Well, we're not the right center. I mean, we don't sit there and go, well, you have selective mutism and this is what we need to do, but we help them understand themselves. The same with misophonia. You've got to help them understand what this is and what's going on so they stop, one, shaming themselves, comparing themselves, feeling bad about themselves, causing avoidance, more anxiety. Like, it's all of that.
We all hate certain sounds, and usually it's something that's out of the norm. Like again, I use the example of a jackhammer, or maybe it's the scraping of a fork against a plate, or whatever it might be. Chalk on a chalkboard. We all hate certain sounds. Imagine how hard life would be if that way of experiencing the sound is something you experience.
And
in
how can you
everyday
have a
life.
conversation if
And
you have selective mutism?
how how can you have a conversation? How can you form a
Right.
relationship? So let's start from a place of understanding. Let's not take it personally. Let's work together on this. And I absolutely agree with you. Every child needs to feel good about some aspect of themselves. And everyone is working on something that's difficult. Everyone
Everyone.
is, including every adult, every kid. We're
We're
all
not
working, we're all
robots.
doing the
And
best we can.
even
Yeah.
AI has to still work on things, doesn't have it all right.
That's true. That's true. It makes a lot of
All
mistakes,
the
and
time. You
it's
can't
trying to
get my
get better
logo
too.
right
Yeah,
on,
yeah,
the templates. Like, it's seriously
yeah.
on my Word documents.
Yeah.
Like, just get it right.
Yeah, so if this is something people are interested in, I made a video about misophonia. If you look up Dr. Ali Misophonia on YouTube, it's a video, Dr. E, I made about a year before I developed misophonia. So I don't talk about my own experience with misophonia, although I do share like certain sounds that are aversive to me. So there's that resource. And then if people are interested more on my anxiety resources, braverwithanxiety.com is where I have my free 7-lesson course on
Oh, that's
anxiety. You can check
amazing.
that
Well,
out.
thank you so much.
Yeah.
And if ever you want to talk SM on your podcast, or on your YouTube channel, I'm happy to do that and educate. And hopefully, you've gotten some just a different perspective on SM a bit. I don't know.
I always love talking SM. I could talk SM, not pun intended, but I could talk SM all day.
Oh, no, me too. I always make the joke that if I'm flying on a plane, I like to sit on the aisle so that the person by the window, we start making a conversation, and they'll be like, so what do you do? And I'm like, really? Let's talk about that. So I'm the same way. I love what I do. And it's obviously, you do too. And I'm glad you and your wife have worked out the flossing situation.
Yes, that was a journey. It was quite the journey, but we're in a good place now. In fact, she's usually surprised. She's like, she'll ask, "Is my flossing bothering you?" And I'm like, "No." And I tell her, like, "I'll let you know if it does now." Like I can very quickly tell her, and it's not a personal thing, but very rarely does it now.
Thank you so much.
Yeah, thank you, Dr. E. Thanks for having
Sure.
me.
Well, we'll be in touch and we'll share resources and all of that.
Thank you for listening to Unspoken Words, a selective mutism podcast hosted by me, Dr. E, and the Smart Center. This episode and all episodes of Unspoken Words is produced by New Edition Productions. Don't forget to submit any questions you have from today's episode using our Ask Dr. E form on our website. Just head to selectivemutismcenter.org/ask DRE. I'd love to answer your question in a future episode or blog post. Remember, for the best of this episode and every episode of Unspoken Words, please follow the podcast on Instagram and YouTube. We are at unspokenwords_podcast on Instagram and Unspoken Words by DRE on YouTube. Or join our newsletter for additional SM content. We release new episodes every other Monday at 6 a.m. Eastern Standard Time. We'll see you next time.